Hello, my name is Dawn McAdams. I am the District Lead Nurse for Richland School District 2. Before you watch the Bloodborne Pathogens video, I want to provide you with a little bit of information about the Bloodborne Pathogen Standard. The Bloodborne Pathogen Standard was created by the Occupational Safety and Health Administration, also known as OSHA, to protect employees from potentially infectious materials. Each school has 2 copies of the Richland School District 2 Bloodborne Pathogens Plan. They can be found in the principal's office and the school nurse's office. The district plan is reviewed annually and updated as needed. All district personnel should use standard precautions. Standard precautions is a method of infection control in which all human blood and other potentially infectious materials are treated as if they are known to be infectious for HIV, hepatitis B, and hepatitis C. We have no way of knowing which individual may have an infectious disease, so we treat everyone as if they do have an infectious disease. Please remember that good hand washing is the best prevention to contracting illnesses. If you have a cut or abrasion on your hand, please cover it with a bandage prior to coming to work. If you do not have a bandage, the school nurse can give you one. Most students are able to hold pressure to a wound or nosebleed. You can hand them a tissue or paper towel. Each classroom is provided a pair of gloves in case you need to actively assist a student who is bleeding. Please wear the gloves when dealing with blood or other bodily fluids. If you feel you have been exposed to another person's blood, please immediately wash the area with soap and water and contact the school nurse for further guidance. The school nurse will assess the underlying skin tissue, the amount of exposure, and make a determination if this was an exposure incident. An exposure incident occurs when a large amount of blood or other potentially infectious material that is grossly contaminated with blood comes in contact with an open wound on your skin. If an exposure incident occurs, you will be sent for medical care for an exposure incident. If there was not an exposure but a possible injury, you will be sent for medical care for the injury under the Workmen's Compensation Program. Please remember that if it is wet and it is not yours, don't touch it without gloves. Remember to wash your hands frequently with soap and water, drink plenty of fluids, get plenty of rest, and do not come to work if you feel ill. If you notice possible blood or other material dried on a surface, do not clean it yourself. Please call for a custodian to properly clean the area. The HIV virus dies within seconds of hitting the air or object, but the hepatitis B virus can live on surfaces for up to a week or more. The risk of contracting hepatitis B is still very low. All students are vaccinated against hepatitis B. Your bigger risk is contracting the common cold or another virus. I cannot stress enough the importance of washing your hands frequently. Hand sanitizers with alcohol content greater than 60% are fine for the short term, but they do not replace hand washing with soap and water. Now, I'm sure you've heard about COVID-19. It's a type of coronavirus which is spread by droplets when you cough, sneeze, or talk. To lower your risk of contracting the virus, follow these steps. Wash your hands frequently with soap and water. Rub hands together briskly for at least 20 seconds. The use of hand sanitizer with an alcohol content greater than 60% is acceptable until you can wash your hands with soap and water. Wear a face covering when you are outside of your home, shopping, worshiping, working, etc. Follow the guidelines recommended by your place of employment. Cover your cough. Cough and sneeze into the bend of your elbow, not your hands. Wash your hands as soon as you can, or use alcohol-based sanitizing gel, foam, or liquid. Get plenty of sleep at night and eat a healthy diet, including fresh fruits and vegetables. Stay home if you feel ill, have a fever greater than 100, cough, shortness of breath, body aches, loss of taste or smell. Please notify the school nurse if you have COVID-19 or you've been exposed to someone having COVID-19 so she can determine when you may return to work based on SCDHEC guidelines. If you have further questions or concerns, please contact the school nurse where you are working, or you may contact me at the district office at R2I2. Thank you and have a good day.
Josh, how did this happen?
Oh, I was playing soccer.
Our image of bloodborne diseases has sharpened in recent years. Today, we know more about their transmission, prevention, and treatment. The three most deadly bloodborne diseases are hepatitis B, hepatitis C, and HIV, the human immunodeficiency virus. Research shows that safety precautions such as handling all blood and body fluids as though they are infectious, disposing of sharps safely, and using sharp safety devices have decreased the numbers of exposures to bloodborne pathogens or BBPs. But school personnel sometimes fail to consistently use safety precautions. You can change that. We'll tell you how.
A sharper image. We know much more about the spread and prevention of bloodborne pathogens. We can work smarter, but we can't let down our guard. Let's take a closer look at the bloodborne pathogens putting you at greatest risk on the job. Hepatitis B, hepatitis C, and HIV, and what you need to do to protect yourself against them.
Hepatitis B virus, or HBV, causes serious liver disease. About half the people infected with hepatitis B have no symptoms. Those with symptoms may experience jaundice, fatigue, abdominal pain, loss of appetite, occasional nausea, or vomiting. Most people infected with HBV recover and clear the infection, but about 10% become chronically infected for life. Each year, more than 5,000 people die from related chronic liver disease and liver cancer linked to hepatitis B. The hepatitis B virus poses a greater risk than either hepatitis C or HIV because it is more easily transmitted. As of yet, there is no sure cure for hepatitis B. But fortunately, hepatitis B can be prevented by taking the hepatitis B vaccine and using universal precautions. Your school system may provide the vaccine to you. Hepatitis C virus, or HCV, causes a serious liver disease known as hepatitis C viral infection. This liver disease may cause symptoms similar to hepatitis B, but there are important differences between hepatitis B and hepatitis C. While 85% of people infected with HCV have chronic infections, only about 10% of those infected with HBV are chronically infected. In fact, the Centers for Disease Control, or the CDC, reports about 3 million people in the United States are chronically infected with the hepatitis C virus, while about 1.25 million are chronically infected with the hepatitis B virus. And remember, many people infected with these two viruses have no symptoms at all. That includes about half of those infected with HBV and up to 3/4 of the people infected by HCV. In fact, people who are chronically infected with hepatitis C may have no symptoms for up to 30 years. Yet during that time, the infection may be slowly damaging the liver. Hepatitis C is the leading indicator for liver transplants. Every year, up to 10,000 people die from hepatitis C-related chronic liver disease. Unfortunately, there is no vaccine to prevent hepatitis C. However, newly approved antiviral drugs have been effective in some people who have contracted this infection. HIV attacks a person's immune system and causes it to break down. The clinical picture of HIV infection differs widely from person to person. A number of those infected with HIV remain apparently healthy for many years. The infected person becomes seriously ill when the immune system loses its ability to fight infections. Some infected persons go on to develop AIDS. As many as 900,000 people in the United States are infected with HIV, according to the CDC. The numbers are rising among injecting drug users and women. The number of HIV-infected people who develop serious illness and who die from AIDS has decreased, thanks to the success of recent treatments. People with HIV now live longer and healthier lives, but yet there is no preventive vaccine against HIV. Hepatitis B, hepatitis C, and HIV spread most easily through contact with blood. They also spread through contact with other potentially infectious materials, including semen and vaginal secretions, as well as any other body fluid or tissue containing visible blood. Bloodborne viruses are most commonly transmitted through sharing needles to inject drugs, or having unprotected sexual intercourse with an infected person, or from mother to unborn child before or during birth. At work, you can be exposed to these viruses if a contaminated sharp punctures your skin, or if blood or other potentially infected material splashes your broken skin or the mucous membranes of your eyes, nose, or mouth. That's what we know about bloodborne pathogens. Now let's shift our focus to everyday ways to protect ourselves. These techniques are proven to help guard you from infection. Your school district may have an exposure control plan that details BBP safety measures. The exposure control plan is based on OSHA's bloodborne pathogen standard and CDC guidelines. Use your plan if available to protect yourself. Here's a snapshot of the safety precautions you should take. According to OSHA, immunization against the hepatitis B virus has proven very effective. Your school or school district may or may not provide the hepatitis B vaccine. The hepatitis B vaccine is a series of 3 shots given in the upper arm over a period of 6 months. Today's vaccines are safe and very effective at protecting you from getting hepatitis B infection if the series is completed. Protecting yourself with a hepatitis B vaccine is very important, but it's not enough. We lack vaccines to prevent hepatitis C and HIV infection, so you must follow these safety measures at all times. Standard precautions, as published by the Centers for Disease Control, means treating blood, all body fluids, excretions and secretions except sweat, plus non-intact skin and mucous membranes, as though infected with bloodborne or other pathogens. Standard precautions incorporates features of both universal precautions and body substance isolation practices. It protects you against the risk of bloodborne pathogens, as well as other pathogens. Remember, all body fluids pose a potential risk for infection. Personal protective equipment, PPE, includes gloves, gowns, aprons, lab coats, face shields, protective eyewear, masks, mouthpieces, and resuscitation bags. What's appropriate for your job depends on the level of risk you're exposed to. PPE is always accessible to you, such as in the custodian's closet or on each hall. All PPE is maintained, replaced, and disposed of by your school. However, PPE can't protect you if it's not used correctly every time it's needed, if it's the wrong item for the job, if it doesn't fit properly, or if it's damaged. If your PPE is penetrated by blood or other infectious material while you're wearing it, remove the item immediately. Dispose of it according to your facility's exposure control plan. 2 common types of PPE are respirators and gloves. Mechanical emergency respirators and pocket masks are designed to protect you from a victim's body fluids expelled during resuscitation. Use these devices instead of unprotected mouth-to-mouth resuscitation. You must wear gloves whenever contact with a potentially infectious material is possible. Use heavy-duty utility gloves for housekeeping. Otherwise, single-use disposable gloves are fine. But if you're allergic to materials in disposable gloves, such as latex, use hypoallergenic gloves, glove liners, powderless gloves, or another alternative. See your supervisor about this. Gloves can, however, be torn or punctured, so cover hand cuts or skin abrasions with bandages before school. Replace disposable single-use gloves as soon as possible if contaminated, torn, punctured, or no longer effective. Never reuse them. While both hands are gloved, carefully peel one glove off from the wrist to the fingertips. Then hold it in the gloved hand. With the exposed hand, peel the second glove off the same way. tucking the first glove inside the second. Dispose of promptly and never touch the outside of a glove with your bare skin. Lastly, always wash your hands with soap and running water as soon as possible. Hand washing is your #1 protection against infection, and it keeps you from infecting other people or objects. Wash your hands after contacting blood, body fluids, excretions, or secretions, even if you're wearing gloves. Here's how. Wash hands with soap and running water for 10 to 15 seconds. Rub vigorously over all surfaces, including above your wrists. Rinse thoroughly, then dry with a clean paper towel and discard. Now, using a clean paper towel, turn off the faucet. Antimicrobial soaps or cleaners should only be used when indicated, since they remove your skin's natural protective defenses. Many safe work practices are just common sense. You should not eat, drink, or smoke where you are likely to be exposed to blood or body fluids. Also, do not handle contact lenses or apply cosmetics or lip balms where exposure is possible. And never keep food or drink in places where blood or other potentially infected materials are present. Clean all blood and fluid spills promptly, according to your school policy. Keep work surfaces and protective coverings clean. Wear gloves to handle contaminated laundry and be careful to prevent exposure of your clothing and skin. Deposit wet laundry in a leak-resistant container. Trash may contain sharps or other infectious materials, so do not push it down with your hands or feet. Instead, gently shake down waste containers and carry waste bags by the top, away from your body. Dispose of blood and other regulated medical waste in appropriately labeled, closable, leak-proof containers. Follow your state's regulations as specified in your exposure control plan. And remember, if available, use fluorescent orange-red labels, red bags, and containers. And warning signs must be used to warn that the contents contain blood or other potentially infected material. Good housekeeping is everyone's responsibility. The Exposure Control Plan lists specific methods and schedules for cleaning environmental surfaces possibly contaminated with infectious materials. But here are a few general rules. Clean and decontaminate equipment and working surfaces with an appropriate disinfectant as soon as possible after contact with potentially infectious material. Use a broom and dustpan to pick up broken glass, not your hands. Or call a custodian. Put contaminated sharps and other potentially infectious wastes in closable containers labeled biohazard or color-coded leak-proof containers. Sharps should be placed in sharps containers, not the trash. Handle contaminated laundry as little as possible with minimal agitation. Place items in labeled or color-coded bags or containers without sorting or rinsing them, and use leak-proof bags to transport wet laundry. Regularly inspect and decontaminate bins, pails, cans, and other reusable receptacles likely to be contaminated. Do not panic if you are exposed to blood or other potentially infected material. Immediately wash the exposed skin area with soap and water. If infectious material enters your eyes, flush eyes and exposed mucous membranes with large amounts of clean water. Do not use caustic agents such as bleach, since they can damage skin. Your next step is to report the exposure to the designated person immediately, so that post-exposure evaluation, counseling, and any necessary treatment can begin. Act quickly because with some infections, treatment works best when you start it right away. And remember, exposure does not always lead to infection. To become infected, a large enough dose of the live virus must enter your bloodstream and overcome your body's defense system. To put it in perspective, here are the risks of contracting a bloodborne infection after a sharps injury. Studies report the risk of acquiring hepatitis B for those who have not been vaccinated is from 6 to 30%, or about 1 in 6. For hepatitis C, it's from 2 to 10%, or about 1 in 20. And for HIV, the risk is approximately 0.3%, or 1 in 300.
Now you have a sharper image of bloodborne pathogens. The risks of infection are real and should be taken seriously. But we are making progress in our mission to learn more about BBPs. Right now, our best tool is to follow work practices designed to keep us safe.